Meet Benji, an 8-month-old Beagle who presented for neck pain and inability to walk. A few days prior to his visit, he fell off the bed, landing on his neck, but didn't show symptoms of pain. The next day, he was taken to his vet after seeming lethargic and not wanting to get up from his bed. His vet prescribed medication, but he didn't seem to show improvement. This morning, Benji's thoracic limbs gave up on him.
There are a handful of things that we think of when we have an 8-month-old Beagle with neck pain and difficulty walking. The first is something like inflammation. So Beagles do get a form of meningitis that can cause pain. It can cause fever, which he does not have. So the second thing we worry about, I mean, he's a little on the young side for him.
Yeah, that's what scares me. He's so young.
Yeah, so the most common thing that I see in Beagles causing neck pain and difficulty walking is a slipped disc in the neck. He's a little on the young side for that. That's 1 to 3 years of age is usually when we start seeing that. So still needs to be on our worry list, but it's just a little less likely.
After discussing the pros and cons of moving forward with an MRI, his owner elected to go with this option.
So this is the MRI of Benji's neck. This is a T1 weighted sagittal image of Benji's neck. So his head is to the left, the back of his neck is here, this is the underside of his neck. These are the bones of his neck, and in between each bone is an intervertebral disc. And we don't see any evidence of intervertebral disc disease here. This is a cross section or a slice made right where this green line is. So this is a slice made with the right side, left side, back of his neck, underside of his neck. This is the spinal cord here, and you can see as I scroll through, we get a new picture and the line moves. So with Benji, we were worried about things like intervertebral disc disease, meningitis, and malformations like atlantoaxial instability. The AA joint looks very normal, and we do not see any evidence of a disc bulge here. So we were worried about meningitis. The meninges are the coverings of the spinal cord, and oftentimes with meningitis, when we give contrast, the coverings of the spinal cord contrast enhance or turn white. So this image in the lower left is the same picture as this one, except we've given contrast. And we can see here that the coverings of the spinal cord become very bright or contrast enhancing. On the image in the lower right, again, this is a cross section made right where this green line is, the exact same picture as the one above it, but this one is after contrast and this one is before contrast. We can see the coverings or the surrounding of the spinal cord is very, very contrast enhancing or bright. So this is very consistent with meningitis. So the next thing we did was a spinal tap. And the spinal tap looks at the number of cells, the type of cells, and the protein level. The number of cells should be less than 5 per microliter. And Benji had 2,762 nucleated cells per microliter. So it was very, very abnormal or very, very consistent with meningitis. The next thing we did was look at the type of cells, and the type of cells were predominantly mature neutrophils. When we see neutrophils, the two things that we think of are what we call steroid-responsive meningitis or an infection. We did not see any infectious agents on the spinal tap.
While the team await infectious disease test results, Benji was prescribed steroids. Dr. Wong will re-examine Benji in 2 weeks.
So Rocky's a 7-year-old boxer that presented to us for evaluation of droopiness on the left side of the face. Last week the owners noticed that he was drooling from the left side of his face but didn't think much of it. Then a couple days later she noticed the droopiness on the left side of the face. So she took Rocky to her veterinarian, who recognized that there was facial nerve paralysis on the left. And her veterinarian did some preliminary tests of blood work, a thyroid test, chest x-rays, and a blood pressure, and those were all normal. So then she referred Rocky to us for further evaluation. On examination, Rocky was alert, he was aware of what was going on, He knew exactly where his feet were, all of his reflexes were normal, but he was droopy on that left side of the face. So there was no expression. He could not blink the left eye, but he could blink the right eye. His left ear did not move. His left side of the face just sort of drooped. If he smiled on the right side, it wouldn't smile on the left side. So that told us he had a problem in his facial nerve. The facial nerve is cranial nerve 7. It's responsible for innervating the muscles of facial expression. So when we have a problem with the facial nerve, symptoms may include things like droopiness on one side of the face, inability to blink, but we still have normal vision and normal sensation on that side of the face. The possible causes that we think about in dogs with facial nerve paralysis, one of the most common is idiopathic facial nerve paralysis, but we can also see it with ear infections, we can also see it with brain tumors, meningitis, strokes, etc. So we decided to do an MRI to look at the inner ear, the middle ear, cranial nerve 7, and the brain, and the MRI was normal, so that's fantastic news. The next thing we did was a spinal tap, because sometimes meningitis does not show up on an MRI, but we can find it on a spinal tap. The spinal tap was normal as well. So this is fantastic news for Rocky. Rocky has idiopathic facial nerve paralysis, and that's something that usually doesn't get worse. Sometimes it actually doesn't get better, and that droopiness remains on that side of the face, but it's not something that's going to progress to cause seizures or balance problems or anything like that. So this is overall excellent news for Rocky.
Lila is a 10-year-old Jack Russell who was running and playing in her backyard during the weekend, and when she was taken back into the house, she seemed painful in her back legs. Yesterday, she became unable to ambulate on her back legs and was brought to 7 for further examination.
Her problems in her back, so her front legs are normal. That means the information making it from the brain to the front legs is just fine, but when it tries to make it down to the back legs, there's a problem there. So the third thing that I try and answer is, how bad is it? How severe is the problem? And we grade spinal cord injury on a scale of 1 to 5, with 5 being the most severe. Category 1 is when you're just painful. So some dogs are walking completely normal, but they're painful. That sounds like what she was on Monday. As things get worse, a stage or category 2 is when a dog is still able to walk, but is kind of drunk in the back legs and crisscrossing the legs.
She was doing like
that. She was doing this.
The third category is when we are no longer able to walk, but we can still move our legs. And that's what Lila is right now. Okay. If I support under her legs, I can feel them moving just a little bit, but she's not nearly strong enough to stand up and support herself and walk on her own. So right now, Lila has a spinal cord injury. It's affecting her mid-back spinal cord, and it's of a moderate to severe category, a category 3 out of 5. Okay. And that's what I can tell you just by looking at her. What I cannot tell you just by looking at her is what the cause is. The most common thing that we see in a 10-year-old Jack Russell that was normal one day, was playing and then painful and then can't walk, is a slipped disc. And that's what we want this to be, because that's something that I have excellent chances of fixing. We also have to worry about things like tumors, and we have to worry about things like meningitis and infections. Those can all cause the exact same symptoms of pain and difficulty walking. But we want this to be a slipped disc, because if it is, with surgery I have like 95% chances of fixing her. And even without surgery, there are about 60 to 65% chances that she could get better with time, rest, and medications. So my recommendation, easy recommendation, any dog that's a category 3, 4, or 5, the recommendation is an MRI to find out what we're dealing with, and if it's a slipped disc, do surgery to try and remedy it.
Lila's owners felt the best thing to do was to move forward with an MRI to find the underlying cause of Lila's back pain.
This is Lila's MRI. This is her back, this is her belly. So we're looking at her lower back here. Her tail would be just off the screen here, and her chest would be just off the screen to the left. These are the bones of her back, and between each bone is a disc. This is the spinal cord. If we think of her as a loaf of bread when we make slices, that's what this picture is. This is a slice made right where this green line is. This is the spinal cord. This is the intervertebral disc at L4-5. And as we scroll forward, we'll notice that we see something in the lower left here, compressing the spinal cord. And it's not a dramatic amount, but her signs were dramatic.
Postoperatively, Lila is doing well, is comfortable, and is healing from surgery. Lila will receive physical therapy from our team for the next few days to ensure a speedy recovery.